Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Welcome to another edition of Meet the Docs, sponsored by the Columbus Community Hospital. I'm your host, Grant Otten, and I'm today with Dr. Phil Essay, and you're here in the Visiting Physicians Clinic. So just to start off, can you tell me a little bit about what it is you do?
Yes, I'm what's called an interventional pain management physician. I work with a large group of physicians. We have offices in Omaha and Lincoln, and we come out here to Columbus, and we have been for the last 12 years. We treat patients with chronic pain, mostly spine pain, but all types of chronic and some acute pain as well.
Talking a little bit about how you came into Columbus, obviously education is a big deal. So can you tell me a little bit about where you went to school?
Right. I actually went to high school in Lincoln, Nebraska, at Pius X High School, and graduated from the University of Nebraska in Lincoln. Went on to the University of Nebraska Medical Center in Omaha, and I've practiced in Lincoln, Nebraska primarily for the last 20-some years, 25 years almost.
Well, it's been a long time. And being from Lincoln and practicing in Lincoln, what is it that made you come to Columbus and start practicing here as well?
About 13 years ago, my partner at the time, came out and gave a little dinner meeting for the primary care docs here in town. And that led to a little meeting afterwards, and pretty soon we had a very gracious invitation to come and provide our services for the community of Columbus, and we've been coming ever since.
Very cool. And you're an anesthesiologist, so
I am.
Why is it that you got into this field specifically?
About 70% of all pain management physicians are prior anesthesiologists. It's part of our training through our residency program. Basically, the skill set that's required to manage discomfort in the operative suite or in labor and delivery is the same skill set that you need to manage pain outside of there, with some additional things, of course. For me, it was wanting to get out of the operating room to some degree and more in a scenario where I could interact more with people and do some things to benefit them outside of the operative suite.
Very cool. So what is it all that you can do here out of the Columbus office?
We do just about everything here that we would do in Lincoln or Omaha. Many of our referrals come from the primary care doctors, many come from the orthopedic surgeons, and quite a few of our referrals come from the spine surgeons. I know there's at least one visiting spine surgeon from Lincoln that comes here to Columbus also, but we do a number of different things, and a lot of that has to do with the diagnosis and the conservative or non-surgical treatment of spine pain. Much of it involves putting needles in various places in the spine.
Well, and you kind of mentioned it there, but why is it specifically that someone might come see you or get treatment from you?
The first reason primarily is for diagnosis of their problem. MRI scan's supposed to be our gold standard for diagnosing spine pain, but last I checked, you can't see pain on an MRI or an X-ray. So what we do as interventionalists is we'll go in with a needle and inject medication in one of the various pain-generating places within the spine. And if people get temporary relief, then we essentially have a good clue in regards to where that pain's coming from. And it helps the surgeons if they're thinking about surgical treatment on what to do for that patient.
Well, not only in Columbus and Lincoln, but everywhere you see this kind of treatment, is the technology come quite a ways, especially here in the Columbus office, for you guys to manage people's pain?
It has, and the one tool that we use that has advanced our specialty considerably in the last decade is this thing called a C-arm or a fluoroscope. And the thing that's always been nice about coming to the Columbus Community Hospital is that your hospital here always has state-of-the-art equipment, and they're always on the cutting edge for having the right equipment, allowing us to do the things that we need to do.
So when a lot of people think of pain treatment, they think of opioids or pain pills types things. What is it that you guys treat, and why is it different? Something like that.
Well, they do, Grant. You're absolutely right. People think first about opioids. Opioids definitely have a place in our treatment armamentarium, especially for patients with malignant pain. When it comes to chronic benign pain, we're very selective in regards to use of those opioids, and the primary reason is because we found with time that use of those medications and effectiveness is really rather limited in people with chronic benign pain. And then on top of that is that issue of our soaring prescription drug abuse problem in this country. And so we do everything we can to avoid the use of opioids and use them only in situations where they're absolutely necessary.
Well, Dr. Esse, and a tough question to finish off on, but thank you for joining me today. It's a pleasure to talk to you.
Thank you, Grant.
And thank you guys also for tuning in to another edition of the Meet the Doc, sponsored by the Columbus Community Hospital. I'm your host, Grant Otten. We'll see you next time.